All right, record.
We are ready.
We are recording.
Alright, so starting at the heart, we're going to come off of ascending aorta, aortic arch, and then descending aorta. At this point, it's really just better to call it thoracic aorta because it works for both human and cat. So thoracic aorta, abdominal aorta. 3 branches off the human aorta are going to be brachiocephalic trunk, left common carotid artery, left subclavian artery. The brachiocephalic trunk breaks into the right common carotid and the right subclavian, right there. The common carotid comes up and perfuses the head, in particular the brain. When you look at the human, the internal carotid is going to be much larger, the external carotid smaller. They're going to branch right here, so it's not shown. Here it's covered up by this jugular. The jugular vein is not shown in this model as most people have it. Most people have an internal jugular here, coming all the way down, and an external jugular here, coming all the way down. And the external jugular is always going to be slightly lateral to the internal when it attaches here. So anyway, we'll just call this jugular vein. But yeah, this can be internal and external jugular. We know this is external because it's receiving vein from the facial vein. The facial artery is right next to it. And the superficial temporal artery and vein right there. Also external. So then coming back down, so we've talked about our common carotids. The other one that we have coming off brachiocephalic trunk is right subclavian. Now, as far as the subclavian goes, there are 4 branches that you need to know. There are these 3 here, 1, 2, 3. So from medial to lateral in the human, it's V, T, C. So vertebral, thyrocervical trunk, costocervical trunk. In the cat, it's VCT, because cats are weird. There's nothing else in particular that I would point out, except for the 4th branch, which isn't shown here. Internal thoracic artery is going to be running down like this, so from the subclavian down on the inside of the chest. Your subclavian turns to axillary past the border of the first rib.
So where the
right
yellow
here.
thing is.
Right, so here's where we change from subclavian to axillary. So from here until the surgical head of the humerus, we're axillary, there to there. So all of 4 is in axillary right now. So yeah, that to that. Wrapping around the surgical head of the humerus, kind of right at that border between axillary and brachial artery, we have the anterior and posterior humeral circumflex arteries. We don't know which one we're looking at right now. I would imagine probably posterior, since it disappears behind the humerus. But there's your humeral circumflex artery. We then have a profunda brachii, which branches just after that, and then a few muscular branches further along that aren't named, except for the muscle that they touch. Further down, the brachial artery divides into a radial, sorry, just kidding, an ulnar artery, and a radial artery, which is lateral.
Got it.
Superficial veins of the forearm include, on the lateral side, the cephalic vein, which plugs in at axillary, and then your basilic vein, which plugs in at brachial. The median cubital connects them in the middle, right there. This is the anterior interosseous artery, in case you're interested. Anyway, going down to abdominal aorta now. Oh, well, while we're here, vein, artery, because they're pulmonary, so they switch colors.
Okay.
In the abdominal aorta, the first branch is right here. That's our celiac trunk. It's supposed to have 3 branches, so this guy right here should disappear and fuck off. We don't like that right there. That's not supposed to be there. But this right here is going to be the left gastric going to the stomach, which sits right here. This is the splenic artery going to the spleen. And this is the common hepatic artery bringing oxygenated blood to the liver.
Is that the one that's in the baby and the fetus that changes?
No.
Okay.
What you have in the fetus is a ductus venosus, which changes into ligamentum venosum, which is round ligament. And we'll look at that on another model. Kidneys, so renal artery, renal vein. The renal veins go straight back to inferior vena cava. After your renal arteries, you have gonadal and gonadal. And then your last branch, your last anterior branch before your common iliacs is going to be the inferior mesenteric artery. So up here we had celiac trunk and superior mesenteric. Here we have inferior mesenteric. Your abdominal aorta ultimately ends when it bifurcates to become the common iliac and the common iliac, so right and left common iliac arteries. The common iliacs then branch into internal iliacs and external iliacs. The external iliac retains its name until we go through the obturator foramen, once we leave the abdominal wall, and we become femoral. Femoral then immediately branches to become deep femoral, which is this guy right there. And deep femoral also gives off a muscular branch about the same, or not, femoral also gives off a muscular branch about the same place. So muscular branch, deep femoral, femoral all the way down until you reach behind the knee, then we become popliteal. Popliteal then ends and gives you posterior tibial, which begins about here, let's say.
So would the orange be popliteal?
Orange is popliteal,
Okay.
so right there, popliteal. This is going to be posterior tibial. This is going to be peroneal, and this is anterior tibial. So posterior tibial gives you anterior tibial, then peroneal. And anterior tibial seen again there and here. Now just realize that this is not standard anatomic position.
Anterior,
His foot is turned to the side here,
anterior.
and here his hand is
For
pronated.
training purposes only.
Right, so I don't like that either. I'd like it to be in anatomic position on both sides, but that's all right.
And these veins?
Posterior tibial vein and greater saphenous vein, which in the human is only a vein. In the cat, we expect to see a corresponding saphenous artery. That's this model.
And you went over a lot of these ones.
I can't imagine why. They are not accurate.
Okay.